Hi, my name is Courtney Womack, and this PowerPoint is about cancer cells. So, normal cells versus cancer cells. So, the main difference between cancer cells and normal cells is density-dependent inhibition. Normal cells display density-dependent inhibition of cell proliferation. Density-dependent inhibition is when cells grow to a restricted density, then growth becomes hindered. Tumor cells usually lose density-dependent inhibition. So, the density-dependent inhibition is usually caused by cell-to-cell contact. So this is just the image of the last slide. So this is normal cells versus cancerous cells. So as you can see in the illustration shown, a normal cell, normal and cancerous cells. On the left you have normal cells, and on the right you have cancer cells. And in the center of both normal and cancer cells, it shows unfixable damaged DNA. In normal cells, when this occurs, normal cells trigger apoptosis. Apoptosis is extensively described as a significant mechanism of regulated death that occurs not only as a result of cell damage or external stress, but it also takes place during normal development and morphogenesis. And in the cancer cell illustration, cancer cells can't trigger apoptosis. So when cell death can occur when it's unfixable damaged DNA, this causes the cell to continue to divide. What are cancerous cells? So cancerous cells are described by two heritable properties. The first property is proliferate in defiance of normal constraints. Proliferate means cells increase rapidly in number or multiply. And the second heritable property is invaded and colonized territories normally reserved for other cells. So cells that have the first property but not the second property proliferate excessively but remain clustered together in a single mass, and this forms a tumor. How do cancer develop? So, one of the fundamental features of cancer is tumor clonality. Tumor clonality is the development from a single cells that begin to proliferate abnormally, as I mentioned before in the previous slide. What causes cancer? So there are many factors that causes cancer. These are all the factors below. So the first factor of cancer is aging. So this is the most important factor for cancer and growing older. Most cancer occur in people over the age of 55, but cancer can occur in younger ages as well. Both cancer and aging results from accumulating damage to the stem and progenitor cells. So, certain genetic mutations cause the stem cells to divide out of control, which leads to cancer. The second factor is family history. So, most cancers develop because of genetic mutations. Some genetic changes that increase the risk of cancer are passed from parent to child. Certain types of cancer do not occur more often in some families than in the rest of the population. One example of this would be colon cancer. The third factor is smoking. So tobacco use is the most preventable cause of death each year, but each year more than 180,000 Americans die from cancer as a result of smoking. More than 85% of all lung cancers and 30% of all deaths are caused by smoking. And secondhand smoke can also increase 5% of the cancer risk. So some are more likely than non-smokers to develop different types of cancers, such as lung, larynx, mouth, esophagus, bladder, kidney, throat, stomach, pancreas, cervix, and acute myeloid leukemia. The fourth factor is alcohol. So many people may think alcohol can't cause cancer, but alcohol consumption causes 3.6% of all human cancers. Having more than 2 drinks each day for many years will increase the chance of developing cancers of the mouth, throat, esophagus, liver, colon, lymphomas, prostate, kidney, breast, and ovaries. Fifth factor is sunlight and ionizing radiation. So ultraviolet UV radiation comes from the sun lamps, and tanning booths. It causes an early aging of the skin that can lead to skin cancer. So the sixth factor is organic and inorganic chemicals. So a number of chemical substances revealed to be dangerous at high concentration to chemicals to human health. These cancer-causing agents are called carcinogens. There are more than 100,000 chemical elements in the environment, in which 30,000 of them have been analyzed, and out of the 30,000 analyzed, 275 of them were proven carcinogenic. Many studies have shown that the exposure to asbestos, benzene, benzodiazepine, cadmium, nickel, arsenic, radium, and vinyl chloride in the workplace can cause cancer. So the next factor is viruses and bacteria. So infectious microorganism has also been estimated to cause about 18% of all cancer cases. One example of this is Streptococcus bovis. This bacterium can cause colon cancer. So the next factor is hormone therapy. So estrogen and progesterone are hormones that may increase the risk of breast and uterus cancer, heart attack, strokes, and blood clots. Diethylstilbestrol, DES, is a form of estrogen that was given to some pregnant women in the United States between 1940 and 1971, and women who took DES during their pregnancy showed a high risk of developing breast and ovarian cancers. So the ninth factor is diet and obesity. So people who have a poor diet with reduced physical activity may be at increased risk of several diseases. Obese people will be at a higher risk of coronary heart disease, stroke, high blood pressure, diabetes, and cancers. And this includes many cancers. Cancer of the esophagus, breast, uterus, colon, rectum, and prostate. And the final factor is air and water pollution. So air and water pollution is the result of biological, biochemical, and atmospheric particles, which causes damage to the living environment. So air pollution is a significant risk factor for respiratory infections, cardiac disease, and lung disease. Types of tumors. A tumor is an abnormal mass in the body that grows due to cells reproducing too much or not dying when they're supposed to. There are two types of tumors. Those types are benign and malignant. Benign tumors do not invade surrounding tissue or other parts of the body. It grows slowly and have distinct borders. Malignant are cancerous tumors that grow quickly and have irregular borders, often invade the surrounding tissue and spread to other parts of the body through a process called metastasis. So as you can see in the first image, it's a benign tumor. The cells that's inside this tumor are not cancerous and won't spread. And the second image you can see on the right is a malignant tumor. You can see that it's the complete opposite of the benign tumor. Unlike benign tumors, malignant tumors are cancerous. The cells inside the tumor are cancerous and they can spread to other tissues and organs in the body. So, classification of benign tumor and malignant tumor. So, there are three main groups of cancers: carcinomas, sarcomas, leukemia, and lymphomas. So, carcinomas is a malignant neoplasm made of epithelial cells tending to infiltrate the surrounding tissues and give rise to metastasis. It is a histological type of neoplasm and not a synonym for cancer. Sarcomas are tumors of connective tissue, and thus the tumors may occur in bone, cartilage, fat, muscle, or vascular or hematopoietic tissues. Sarcomas are much rarer compared to carcinomas. Most tend to grow locally and invade the adjacent tissues. Most patients present with complaints of hard mass or pain, chiefly because of the pressure on the nerves and soft tissue. And leukemia is a colonial proliferation of hematopoietic stem cells in the bone marrow. In other words, leukemia affects the bloodstreams and bone marrow, and lymphomas mainly affects the lymphoids and the lymph nodes. But although there are three main groups listed, leukemia and lymphomas are both forms of they're both forms of blood cancers that can affect the blood. What is metastasis? So, as mentioned in the previous slide, metastasis is the spread of cancer cells. Metastasis is how malignant tumors are able to spread throughout the body, around the body. So, the development of metastasis requires cancer cells to leave their primary site and circulate in the bloodstream. Endure pressure and blood vessels assimilate to new cellular surroundings and secondary site and escape deadly combat within the immune system. So, oncogenes and tumor suppressor genes. So, in a normal cell, tumor suppressor genes prevent cancer. In cancer cells, DNA changes that inactivate tumor suppressor genes can lead to uncontrolled cell growth causing cancer. So, oncogenes and tumor suppressors are two main classes. An oncogene is a gene capable of inducing one or more characteristics of cancer, and a tumor suppressor inhibits cell proliferation and tumor development as mentioned. It plays an important role in